Hi, I'm Charlie, and I'm Nebraska's first kid governor.
It's great to meet you. I'm Kelsey Klute. I'm a cancer doctor. I'm a medical oncologist, and I work at the University of Nebraska Medical Center here in Omaha.
So, what do you do, and how do you help people?
So I'm a doctor. I'm an oncologist. I'm a doctor who takes care of people who have cancer. And specifically, I'm a medical oncologist, so I treat cancer with medicines. How do I help people? So people who have cancer, which is a disease that's really common, come to see me and some of the other doctors that I work with, hoping to get treatment for their cancer, which we hope can get rid of their cancer and help them get back to living a really normal life.
Yeah. How do you help people who have cancer? How do you help their families?
Yeah, that's a really good question. So cancer can be a really scary journey, both for people who have cancer and for the people who love them, so their family and their friends. Sometimes the scariest thing about cancer is just the uncertainty about what's going to happen to me, what is treatment going to look like, how's that going to affect my life and my ability to take care of my family members and do the things that I like to do. So a big part of what we do, in addition to trying to treat the cancer, get the person who has it better, is to help just educate people with cancer and their families about what to expect. Because sometimes that makes things less scary. If you know what's ahead, you kind of know what to expect and can kind of plan for things. But other things that we do and other people that I work with can be really helpful in terms of supporting people and their families through a journey with a cancer diagnosis. So the nurses that I work with spend a lot of time answering questions. People call in with questions all time of day, just answer questions, make sure everyone has a good understanding of what's going on. But we also work with people like social workers who can help make sure people have enough support to help safely take care of them at home, and sometimes can find resources in the community to help them with things like getting rides to treatment or doctor's appointments, or places like Hope Lodge to give them a place to stay if they live far away from the place that they're getting cancer. And so we have a lot of team members who really help try to support them in many different ways through their cancer journey. So some of my job is recognizing what the needs are of the patient and their family, and helping connect them with the right people to help them through it.
Yeah. What's something that you wish kids understood about cancer?
I think a really important thing to understand about cancer is there are a lot of different kinds of cancer, like hundreds of different kinds of cancer. And so if you hear about a friend of yours who've had cancer, or their family member had cancer, that doesn't really tell you what's going to happen with your family member who might have cancer, because every type of cancer is so very different. The way that we treat it is so very different. And so there are a lot of very specific things to each person's journey with cancer, because there are so many different types of cancer.
How do you help support people if a child has cancer?
I personally don't take care of children who have cancer, but a lot of people that I work with do. And so there are specific doctors who take care of kids with cancer, because kids get very different types of cancer than grown-ups do. And so they'll have a whole team of doctors, nurses, taking care of the child who has cancer. One unique role that exists to help kids who have cancer or other serious types of illness is something called a child life specialist. Their entire job is to help make sure a child who's getting treated for any type of serious illness, including cancer, is as comfortable as possible with the people that are taking care of them and the place they're getting treated, and to help make things go as smoothly as possible, make things the least scary as they can be. A child life specialist is someone who will come to a hospital or a clinic appointment and kind of help the whole team make things go smoothly for the kid who's in that situation. And they can also be really helpful at just making sure the child understands as best they can what's going to happen to them and answer any questions that they have about their illness.
What's the difference between children's cancer and adult health?
A big difference is that kids tend to get very different types of cancer than adults. And in many cases, we have much better treatments for the cancers that children get than we do for the types of cancer that adults get. And so in many cases, if a kid gets a cancer, there's a good chance that the cancer can be cured, that we can get rid of it.
Thank you so much for talking to me, Doctor.
Yeah, you're welcome. Thanks for having me. High five.